Hi, I'm Dennis Richardson. I'm state representative from Southern Oregon, and I'm also one of the co-chairs for Ways and Means. And what that means is that we have a Republican co-chair from the House, and that's myself. We have a Democrat co-chair, which is Peter Buckley from Ashland, and then we have Richard Devlin, who is the Senate co-chair, and he represents the entire Senate because the Democrats have a majority there. And in the House, as you know, we have a 50-50 split. Well, throughout this session, the three of us have had the responsibility to work through more than 100 budgets and find a way for them to become balanced that could then be placed before our committee, and then it works across the House. They work their way across the House and the Senate floor for a vote. We've done that. Almost all of the budgets are completed now. One of them that remains is the Department of Corrections. Now, corrections includes all of the prison systems as well as some of the other areas that deal with public safety. And so there's a $21 million hole, that hasn't yet been filled. We have the money already to fill it. The question is, should we use the reserves that are available, or should those be used elsewhere? And so one suggestion is that maybe we should change the sentencing guidelines for Oregon in a way that would free up almost $20 million by essentially changing the probation lengths and how long people are serving their sentences and so forth. I've been asked for an alternative because the Republicans haven't been really comfortable with just saying, yeah, let's just change the sentencing. The alternative that I proposed is one that the public employee unions aren't real happy with. Because, as you may well know, Oregon is one of those few states in the entire country that pays 100% of their benefits for health care for all the state employees. We're not talking about teachers, we're not talking about school districts, we're not talking about cities and counties, only the state employees, the state workers. And so the suggestion that I've proposed is in House Bill 2011. It was just presented just this week, and it says basically that all state workers should pay at least $50 a month toward a health benefit plan that costs the taxpayers more than $1,200 a month. This $50 a month minimum, it's based on what's 5% of a state worker's employment, just their base salary, and pay a minimum of $50 a month and a maximum of up to $500 a month. If you're making more than $100,000 a year as a state worker, maybe $500 a month toward health benefits is not unreasonable. Anyway, so with this suggestion that maybe we all ought to be paying a minimum of $50 a month, the public employee unions have read about this in the papers. They're unhappy with it. They sent 100 people today to come and let me know that they think that they shouldn't pay a dime toward health benefits. Well, I've tried to explain to them that we all need to have some shared sacrifice, that even employees for the state ought to pay their fair share toward health benefits. If we were to implement House Bill 2011, it would free up a minimum of $69 million in the next 2 years that could be used not just to fill this $21 million hole for Department of Corrections. It would also provide money that we could give maybe $10 million toward community colleges, which have a tremendous increase in their enrollment as unemployed workers are trying to gain new skills. It could allow $15 million toward K-12, additional money to help us not have to lay off so many teachers or cut days from our school year. This is additional money on top of what we presently have already allocated in the budgets for community colleges and for K-12. If we were to pass this minimum of just 5%, this $50 a month toward health care, or 5%, what we would have is the ability to have less cuts to those who are providing the care every day, 24/7, for our developmentally disabled people and for our seniors who've outlived everyone else that they've known and are looking to the state to provide their ability just to survive. And those, right presently under those budgets, those providers of services are being drastically cut in what they can be paid by the state to provide such important care. In addition, we're cutting the doctors by more than 11% from the reimbursement rates that they're getting to care for Medicaid, Medicare eligible, dual eligible individuals that are relying on the state and federal government to provide their health care. If we were to just pay $50 a minimum of our health benefits as state workers, we could save a dramatic amount from those cuts to those workers who are providing this care to our citizens who are most vulnerable. We could provide better education, and we could provide more to our community colleges and to our university systems. We have the ability to do that. All we need to do is be willing to say to our state workers, yes, it's a sweet deal that you've had 100% of these benefits paid all this time till now, but from now on, we need to have you to pay your fair share and contribute just 5% of your salary, a minimum of $50, toward your health care every month. That's what House Bill 2011 does. That's an alternative. It's not a magic alternative. It's just a suggestion. And it wasn't very well received by the public unions. You can see why not. Nobody wants to start paying something when they had it for free. But it's time for shared sacrifice and for all of us to pay something toward our health care. And if you're a state worker, that means $50 a month or 5% of your income, up to $500. It's time for a change, because the money it frees up will be used as a higher priority than paying everything toward these benefits. It will be diverted toward helping our most vulnerable students and our most vulnerable citizens, and enable our students to have a better education they'll have without it. Thank you very much for listening.